Hi, it's Dr. Joe Markovich of Charleston Spine and Disc. I'm here to answer the question, why do I have back pain? Well, the overwhelming cause of back pain is disc destruction, disc herniation, rupture, disc bulges. And generally, people don't understand about the disc. Let me show you what a disc kind of looks like. It's kind of hard to see here, but you've got a jelly donut. And around the jelly donut, you have rings. All these rings represent the annular fibers. You can kind of see a little bit there. This jelly donut is made of mostly water, 80% and 20% gel. So whenever there's pressure on this gel or water, it wants to bulge out into these layers. Call us these invaginations. Check. And the first 2/3 of the disc is why we could be having a bad disc and we don't realize it. 2/3 of the disc feel no pain. The only place you feel pain is the outer 1/3 of the disc. That outer 1/3. So in the outer 1/3 is where you can feel the pain. So this has to bulge all the way out to here before you feel something. So if this starts to bulge out, which discs do after a period of time and whatever you do, you've got a disc bulge here. The medical approach is to come in here and cut this off. Or go in here and inject this with a big needle to take the pain away from this thing. When in actuality, what needs to be done, this disc needs to suck back in, and that's what we do here. This disc needs to suck back in, and it needs to be healed in these annular fibers. Okay, these are called annular fibers. So what we do is we use spinal decompression and a host of other therapies with the New Life laser to heal these areas. We decompress this disc. Here's what the vertebra looks like. And it's got the disc in between. See, this nerve root is like right here. The nerve root's right here, and that bulges on that, and that's what causes the pain. And also the outer annular fibers. So this needs to be decompressed. The disc sucks back in, and then we shine the laser on this area that's injured, and it increases the healing by 3 to 5 times or more. The body's able to heal this much faster. Eventually it would heal if you could keep it decompressed and do all the things without, but most people don't have the ability to just lay down and get it taken care of. This way the healing goes 3 to 5 times and you more or less can have your normal life in the meantime. So you'll shine the laser on this area, it heals the disc and keeps it from bulging out instead of cutting it off and then causing future problems, future surgeries and more problems. You see these screws? This is what they do. First they cut the disc off, then they put these screws in your back to keep you from moving it. They put 6 screws, 1 below, 1 at the vertebra, and 1 above, and with plates and rods and all kinds of nasty stuff. So these big old screws here, you can see, they're as long as my finger. These things are as long as my finger. They go through the vertebra, and they permanently weaken you. Now let me ask you a question. How is it possible that these things could go inside you? Is it possible that these things could be put inside you and you could feel better? Of course not. You can't put this stuff inside somebody they're going to feel better. It's just one of those crazy things that they do. You can't put this inside somebody and expect them to feel better. They're not going to feel better from this. It's going to be permanently damaged. So that's what causes your disc pain. That's what causes your back pain. And that's what we fix here at Charleston Spine and Disc. It's Dr. Joe, beautiful Charleston, signing off.